Thank you. I want to thank you all as well for coming to join us or for Zooming with us tonight. And I have two questions while you watch the presentation. What touches your heart? And if you have a pencil and paper with you, write it down. And what inspires you? So without further ado, let's start our presentation. Envisioning the future of mental health with NAMI-SCC. Some fireworks for you. NAMI-SCC, the National Alliance on Mental Illness, envisions a future where those with mental health conditions and their families thrive. Our mission, we provide support and hope and healing for people affected by mental illness and their families. We advocate for sufficient resources to advance lives free of stigma and discrimination. We have a vision. We envision a world where people affected by mental illness experience acceptance and compassion and live healthy, fulfilling lives supported by a caring community. Our values: hope, inclusion, empowerment, and compassion. I'll tell you about our programs. We have 10 programs for peers, families, youth, providers, and the community, and we serve 6,700 people a year. People in our programs often move from hopelessness to healing to becoming NAMI teachers and facilitators, giving back to the community. We have classes in English and in Spanish for those with mental health conditions and the people who love them. Our classes are called peer-to-peer, family-to-family, basics, and provider education. And here's a quote from a class participant. NAMI's family-to-family class gave me tremendous skills to communicate and accept the reality of the illness and the importance of being informed. Learning so much about the topic of mental illness has really helped me to cope and help the people in my life who mean the most to me. We have support groups, 5 free support groups per week for peers and families in English and in Spanish. We have a helpline providing resources and support in English and in Spanish. Here's another quote. We know NAMI is there when we need support, whether it's talking to someone who understands or being directed to what support group or classes might be best for our family or loved one. We have youth programs, Ending the Silence, which is school presentations for teens, parents, and teachers. And we have classes and support groups for parents of youth. We have presentations, 6 speaker meetings a year in our own voice presentation, ambassador presentation, and community group presentations. And now the plan. NAMI-SCC is keenly aware and deeply experienced with the urgent needs of our mental health community and the complexities involved. Through our work, we continue to see and hear about the many gaps and often desperate needs in a mental health system, which too often fails to provide needed care. This growing awareness has led NAMI-SCC to embark on an extensive community input and planning process to address the gaps. The process. We gathered input from the community on urgent mental health needs. 200 people participated, peers, those with mental health conditions, families, community, organizations, policy members, and most likely you. We listened and we created a plan to address what is not working and to strengthen what is working. So I'd like to introduce you to Sophie Tierney, our Ending the Silence program coordinator, who will take it from here.
Hi everyone, thanks for joining us in creating a community where all people with mental health conditions, including our youth, will get the care that they need. And this is how we'll do it. Our plan has 6 main goals. Our strategies for each goal are to enhance NAMI programs, add new NAMI programs, and to advocate for change. Starting with our first goal, people in Santa Cruz County will get the best possible care through an increase in quality, accessibility, and utilization of mental health services. The highlights for our goal are to advocate for change. We need local, state, and federal legislative efforts to improve, expand, or provide quality mental health care services, facilities, step-down and crisis care, facilities for youth, supported housing, high-quality providers, and payer source parity. To advocate to decrease stigma will address and reduce stigma and discrimination, including reluctance of individuals to ask for help, seek treatment, and/or attend support groups. We'll address neighborhood stigma and discrimination that limits increased mental health housing and facilities. This is a quote from someone in our community. When my 16-year-old son had a psychotic break, he had to be transported in an ambulance out of county, strapped in place as there was no local psychiatric hospital for youth. We'll increase programming in South County in English and in Spanish, expand NAMI Helpline to become a full family mentorship program, and collaborate with suicide prevention. We'll explore NAMI National online signature education programs, new short version of provider education, and new family and friends 4-hour presentation. Our second goal is to have peers strengthened abilities and confidence in managing their own lives. To do this, we will find education and employment opportunities for peers in North and South County, encourage North and South County peer involvement in state and federal advocacy on legislative efforts and the local mental health advisory board, enhance NAMI programs by addressing specific needs for a diversity of mental health conditions in North and South County, increased recreational activity opportunities for peers, and collaborate with suicide prevention services to enhance our offerings for youth. New NAMI programs will increase support for peers in South County and implement a peer mentorship program upon discharge from the hospital. Our third goal will be for families to have increased resilience. We'll advocate for change by including the whole family in providers' treatment planning and ongoing support, and have family advocate at County Behavioral Health to serve adults and youth in English and Spanish. We'll enhance NAMI programs by increasing the frequency of offerings of existing programming to support families in English and Spanish, and new NAMI programs will develop a family mentorship program in English and Spanish. I will now introduce you to our NAMI Santa Cruz County Programs Manager, Anastasia Bubulovich.
Hi, everyone. So for such a complex issue as mental health care, we really need to form strong partnerships and have a strong collaboration in our community. So let's work together to end the suffering of those with mental illness and their loved ones. Continuing on our goals. Goal number 4, youth receive adequate prevention services. Some highlights. We want to advocate to address and reduce stigma through community education, and advocate for an increase in youth mental health services, in acute care, day programs, counselors in schools, and mental health education in the schools. Here's a quote from a participant in our Ending the Silence program. It made me speak up and it felt like my whole true self shined again. We want to enhance our current programs by continuing our Ending the Silence program and add follow-up resources. And we will continue to collaborate with suicide prevention services to enhance our offerings for youth. With new NAMI programs, we want to partner with schools and existing initiatives. Goal number 5, youth and adults receive early intervention before or at the time of a first psychotic break or mental health episode. Here's our highlights. I want to advocate to explore evidence-based programming for first break care. Want inclusion and education of family or caregivers as a critical part of the treatment team. Leverage partnerships with agencies supporting youth, and promote early involvement of NAMI Santa Cruz to support family and individuals at the time of first break. Want to enhance NAMI programs by expanding NAMI support groups for parents of youth, increasing family enrollment in the NAMI basics class for parents of youth, provide speaker meetings on the topic of first break, and provide NAMI informational packets to healthcare facilities. New NAMI programs. Partner with telecare and county behavioral health to connect peers and families experiencing first break to experienced NAMI families and peers. And goal number 6, people living with mental health conditions are diverted from justice system involvement. We'd like to see improved psychiatric care services and staff training within jail. Advocate to offer support groups and mental health education to the incarcerated. Connect those released from jail to mental health services. Explore and implement Sheriff's Stepping Up initiative. Explore court-ordered outpatient treatment. And create a navigation/triage center/sobering center. We would like to expand on the following resources: Santa Cruz Behavioral Health Mobile Emergency Response Teams, and add peers. Santa Cruz Behavioral Health Mental Health Liaisons with law enforcement to 24-hour treatment facilities like Telos, El Dorado Center, and Psychiatric Health Facility, and expand on the Behavioral Health Court. We'd like to increase NAMI's participation with law enforcement agencies, protocols, and policies, and seek crisis intervention training for all law enforcement. Learn about existing resources. Educate criminal justice stakeholders about our current NAMI programs. Distribute NAMI's Jail 101 Guide for Families. Continue crisis intervention team trainings with county behavioral health. Develop specific short trainings for law enforcement agencies. And develop resources to offer peer-to-peer and family-to-family classes in law enforcement settings. For new NAMI programs, we will explore better support to families of loved ones in criminal justice system and offer mental health education to DA's office, public defenders, probation, and behavioral health court. I'd like to pass it along to Noelle Perez, our Development and South County Programs Coordinator.
Thank you, Annie. And thank you all for joining us tonight. I want you to remember what Therese said in the beginning. What touched your heart and what inspires you from this presentation? How will we do this? With these values in place: hope, compassion, empowerment, inclusion. With these key shifts from isolated efforts to whole community approach, from scarcity to opportunity, from stigmatization of those with mental health conditions to acceptance and mental illness regarded as a mental health condition, from fear to compassion, understanding, and knowledge. Individually, we are one drop. Together, we are an ocean. We can do this together as a community. How can you help? Click the link in the chat to join one of our teams to make a difference in the mental health of our community. Team A and B, improve quality of mental health care. Team A, publicly insured, increase capacity for both residential treatment, acute crisis residential, and supported living, and increase capacity for outpatient treatment for mental health and co-occurring disorders using evidence-based treatments. Team B, privately insured, increase the services available within the county to privately insured individuals requiring treatment for mental health or co-occurring disorders on a basis equivalent to those provided for other medical issues. Both residential and patient treatment will be fully implemented, would have equivalency in in-network coverage and reimbursement rates. Team C, diversion from criminal justice system. Fundamental goal, reduction and elimination of individuals with mental health and substance abuse disorder being adversely impacted by the justice system for behaviors resulting from their medical disorders or financial circumstances. Team D, improve your youth mental health. Fundamental goals, identify and implement new services and added resources which promote youth mental health, assist in preventing onset, initiate intervention at first episode breaks, expand treatment options for both residential and outpatient treatment. Join our South County Task Force. Goal, expansion of services and NAMI programs in South County. You can also fill out the survey in the chat to join a team. And you could also visit our website at www.namiscc.org to join one of these teams. You can also donate to NAMI-SCC today so those with mental health conditions and those who love them thrive. Thank you. The 200 plus community members who contributed to the strategic plan, NAMI Board Strategic Planning Team, and NAMI staff. Thank you to Impact Launch for leading the strategic planning. I would like now to introduce you to our board vice president, Melissa.